Yes.
Figure.
Okay.
Shall we start?
Yeah, we can. We are live. Yeah.
We are live. Okay. Hello all. Myself, Dr. Rupesh Reddy, consultant radiation oncologist at Onco Cancer Center, Kolkata. So I welcome you all on this YouTube live session for advanced lung cancer as a part of National Cancer Awareness Day today, that is November 7th. So, and as we all know, November is the Lung Cancer Awareness Month. So I feel immensely privileged to introduce Dr. Rajiv Jena, consultant medical oncologist at Onco Cancer Center, Kolkata, and consultant medical oncologist at Onco Cancer Center, Hyderabad. So lung cancer is the leading cause of cancer death in both men and women worldwide. Cigarette smoking is the one of the most top risk factor for lung cancer, with more than 80% cases caused by tobacco itself. So, but unfortunately, 70% of lung cancers are detected at very advanced stage, where the survival rate is very low. According to Globocon 2020 report, lung cancer is the fourth leading cause of cancer in India after breast, head and neck, and cervical cancer, and fourth leading cause of cancer-related mortality after breast, cervix, and head and neck cancer. So, coming to the types of lung cancer, there are mainly two. Lung cancer is broadly divided into two types: non-small cell and small cell. Non-small cell constitutes around 85% of lung cancers, which includes adenocarcinoma, squamous cell carcinoma, and large cell carcinoma. And small cell constitutes about 15% of lung cancer, which is always associated with smoking and has very poor prognosis. So, Dr. Rajiv, kind of explain about the risk factors for lung cancer.
Okay, as you have already told, smoking is the major risk factor for lung cancer. About 90% of all lung cancers are attributable to smoking, tobacco in any form, like cigarettes, BD, anything. So it has been seen that smoking increases the risk of lung cancer by 30 times if it is compared with those who do not smoke. Also, the risk of lung cancer is dependent on the cumulative dose, like how much you have smoked throughout your life, which we usually quantify in terms of pack years. So what is a pack year actually? Like a standard cigarette pack is 20 cigarettes. So if somebody is smoking 20 cigarettes a day for 1 year, it is one pack year. Similarly, if he is smoking 10 cigarettes a day for 1 year, it is half a pack year. So it has been seen that somebody who is smoking more than 10 to 20 pack years, he has a history, then they have increased risk of getting lung cancer. So it is the most important cause. Similarly, passive smoking is also very lethal. Like you don't smoke on your own, but you are inhaling the smoke by others. So that is also shown to have increasing the risk of getting lung cancer by twice, like 2 times. What are the other risk factors? Those are exposure to occupations where we have workers in asbestos, beryllium, arsenic, cadmium, nickel industries. They get the exposure to these occupational hazards. Also, we have air pollutants, which also cause lung cancer. Family history. If somebody has a first degree relative, like parents, they have an increased risk of getting lung cancer. Also, other causes we can see, like anybody who is having lung diseases like COPD, that is chronic obstructive pulmonary disease, or those who have lung scars, they have increased risk of lung cancer. Somebody who has previous malignancy, like they have taken radiotherapy for some thoracic malignancy like breast cancer, lymphoma, they are at increased risk. Also, we have radon gas exposures, which is also a risk factor. People who have HIV, those who are immunocompromised, are at increased risk of getting lung cancer. Similarly, lifestyle factors like those who are not taking a proper diet with fruits and vegetables, they have increased chances. Yeah.
Dr. Subur, kindly explain about what symptoms a patient of lung cancer can present to us.
Okay, so the symptoms of lung cancer depend on the extent of the disease. So let me enumerate the symptoms based on where the disease is and how accordingly patients present. So if the disease is restricted only to the lungs or the chest wall cavity, the patient present to us with history of cough for a longer duration, about 3 weeks or 4 weeks or more than that. And the patient gives a history of blood in the sputum, which in medical terms is called as hemoptysis. And they can also have chest pain, which is typically described as a pricking type of a pain, which can be either intermittent or continuous in nature. If the cancer has spread to the surrounding tissues, there can be symptoms accordingly, such as a change in the voice or a hoarseness in the voice. And they can also present with a swelling in the neck, which is called as a lymph nodal swelling. And if the cancer has spread to other organs, so the patient can present with significant weight loss, loss of appetite. And if the cancer has spread to the bones, the patient present with a lot of bone pains, which typically increases in severity at night time. Another important symptom is that if the patient has the disease spread to the brain, they can present to us with symptoms of headache, vomitings, blurring of vision, and even seizures. So based on the extent of the disease, we have a variety of symptoms with which the patient come to us.
Yeah. Dr. Rajiv, can you please explain what are all the investigations the lung cancer patient might need when he presents to us?
If somebody we are suspecting lung cancer enters the OPD, first we take a proper history, even including the history of smoking. Then we do a proper physical examination of the patient. Apart from this, a routine blood investigations are sent and imaging is done. So what imaging we usually do is PET-CT scan, which in which we can know the spread of the disease. If PET-CT scan is not available, we do a CT scan of the chest and abdomen to see the distant spread of disease. Usually it has been seen PET-CT is superior in that respect to CT scans. What other investigations like MRI brain, where MRI is not available, we usually do a CT scan. In case of small cell lung cancer, which you mentioned, Dr. Rupesh, which has very bad prognosis, almost many cases they have asymptomatic brain mets at presentation only. So routinely we do a MRI brain in those cases. And in terms of non-small cell lung cancers, those patients who have symptoms like Dr. Subur already mentioned, headache, vomiting, seizures, in those cases and stage 2, 3 onwards, we usually do to rule out any brain mets. Others, if somebody has any bony pain, we do a bone scan. Apart from this imaging, we need to first confirm the histological diagnosis, for which we do biopsy from the tumor tissue, which can be done by either at CT guided route or bronchoscopy guided or some other means. Apart from these investigations like imaging and biopsy, usually we do some special tests. These special tests are some driver mutation testing and PDL1 testing, which we do for those who can afford or who can take targeted therapies and immunotherapies, which have been seen to be substantially, they have shown good benefits. Yeah, over to you.
Yeah. Coming to the stages of lung cancer, as we all know, lung cancer is divided into 4 stages. The stage of lung cancer describes the extent of cancer in the body. It is used for assessing the prognosis as well as treatment to define what treatment is appropriate for a patient. So usually stage 1 and 2, they are very early disease, it is called, and it is minimally spread into the healthy lung tissue, and it is easily operable. So the local treatment is appropriate, like surgery. The most common surgery being lobectomy. Now the latest is VATS, which is called
Video assessment.
thoracotomy procedure. We can go for surgery, and then if the patient is not affording, then we can go for high dose radiotherapy called SBRT. And stage 3, the patient cancer is already spread to healthy lung tissue to some great extent. So the main modality of treatment will be chemotherapy combined with radiotherapy, which is a aggressive mode of local treatment, as we can say, because here surgery we cannot do because it is already spread into healthy lung tissue, and creating a resection, healthy resection margin is not possible in stage 3. And stage 4, it is advanced lung cancer. It is already has spread to other distant organs at the time of diagnosis. So local mode of treatment cannot be done because there are multiple organs involved. So we cannot treat all the organs simultaneously. So we can we go for chemotherapy or immunotherapy or targeted therapy, depending on the molecular diagnosis and all. If it is available, then we can go for all these options. So Dr. Subur, can you please elaborate about stage 3 lung cancer?
Right. So Dr. Rupesh, as you have already mentioned regarding stage 3, so this is one stage wherein the tumor is extending from the normal lung tissue into the nearby structures as well. So it has gone to some of structures called lymph nodes and all, and it is not amenable for a surgical treatment. So the option left for us is something called as a radical radiation along with chemotherapy. So this is called as chemo radiation. And now with recent advances in medicine and lung cancer treatment, we have an option called immunotherapy in the stage 3 lung cancer as well. So the patient who have completed radiation, we can put them on something called as a maintenance treatment with immunotherapy. So we are using maintenance treatment to prevent relapses in such patients. So the drug used for immunotherapy, the agent is called durvalumab. So post completion of chemotherapy and radiation, we use this particular molecule for a period of 1 year to prevent relapses. And with the evidence that we have in clinical trials and whatever data we have, so this particular molecule has shown that it can prevent relapses significantly in stage 3 patients post completion of radiation. And it has also shown to improve the survival in these patients as well, as compared to no immunotherapy. So this is the treatment for stage 3 cancer, where we give radiation to all the diseased lung along with weekly chemotherapy just to increase the sensitivity of radiation. Once the patient completes the radiation, we can put them on something called as maintenance immunotherapy for a period of 1 year. Over to you, Dr. Rupesh.
Stage 4 lung cancer, as I have already mentioned, it is treated by chemotherapy or immunotherapy or combination of both, and targeted therapy in case of mutations, if molecular analysis is available. And suppose a patient has an advanced lung cancer, he may most probably present with bone pain or chest pain. So it has to be treated with appropriate opioid like buprenorphine and fentanyl and morphine, and short course radiotherapy can be used for palliation. So I will explain about the chemotherapy drugs in brief. So usually lung cancer is treated with platinum doublet, with pemetrexed if it is adenocarcinoma, and platinum doublet with taxanes or gemcitabine in case of squamous cell carcinoma. So there are certain advantages of chemotherapy. Chemotherapy, it acts on tumor tissue irrespective of the mutation status, and it is comparatively cheaper. So we can use for patients who are not affording for higher treatments like immunotherapy and targeted therapy, and who cannot afford to take these tests, we can start them upfront with chemotherapy. So the disadvantage being the chemotherapy, it kills the cancer cells as well as the normal cells. So we will get more side effects. Like the normal cells of body will be destroyed, like the mucosa, skin, hair, all these tissues will be destroyed. Accordingly, we will get the side effects like fatigue, tiredness, loss of appetite, nausea, vomiting, and passing multiple stools per day, like called diarrhea, and constipation. Patient may have oral ulceration, and decrease in blood counts may patient may require frequent blood transfusions and hospitalization. And if patient will go for what is called as neutropenia, then patient may need high dose antibiotics. And patient may also have many infections, as his immunity will be compromised in case of chemotherapy. And if patient might have severe hair loss, especially with some kind of drugs called taxanes. And if patients might also have skin and hair changes. So, Dr. Rajiv, can you please tell what is targeted therapy and advantages and disadvantages as well?
Okay, first to speak about targeted therapy, first we need to understand what are mutations. Mutations are some defects in the genes. These genes, when they enable cancer cells to duplicate fast, survive, and spread in the body, these mutations are called driver mutations. That is, they drive the growth of the cancer cells. So these targeted therapies which we are talking, they target the driver mutations. That is the mutations which are responsible for the growth of cancer cells. So the targeted therapy, they are very accurate and precise in hitting these mutations in the tumor cells, and so they spare the normal cells. So they have good outcomes in terms of survival, and also they cause less side effects. But it is not like they do not cause any side effect. They have side effects of their own. Usually they cause diarrhea and skin changes, which are common in these. And one more thing is they are a bit costlier than the normal chemotherapies. Usually nowadays in targeted therapies, we have analysis to do driver mutation analysis for EGFR, ALK, ROS, RET, MET, different mutations are there, for which we have their specific tyrosine kinase inhibitors, which are oral tablets, which if one of these comes positive, oral tablets can be given to the patients, and patients have been shown to increase survival in months or years. So these are good alternatives to chemotherapy. Also, they are they cause lesser side effects.
Yeah. And Dr. Subodh, can you please explain about what is immunotherapy and what are the advantages of immunotherapy?
Sure. So before I actually talk in detail about immunotherapy, let me tell you some basics of how our immune system acts against cancer cells. So cancer cells, they have this special property wherein they suppress our immune system so that they are not be inhibited by our own immune system. So they have continuous survival based on that. They evade our immune system, which is what is called. So in immunotherapy, what we are doing is we are introducing certain agents in the body which will activate our immune system, which will activate our lymphocytes so that they can act on the tumor cells accordingly and then destroy them. So this is actually a certain sort of a targeted therapy only. So what we do is, it is a simple injection form. It activates our T lymphocytes, destroys the cancer cells, and has lesser effects on normal tissue. So these are some of the advantages with immunotherapy. And all the problems that we are facing with chemotherapy are not seen with immunotherapy. So all the side effects that Dr. Rupesh has mentioned, nausea, vomiting, loss of hair, loss of appetite, or decrease in the cell counts, decrease in the hemoglobin percentage, these are all not seen with our immunotherapy agents. So they are safer and with lesser side effects, and they are more specific compared to chemotherapy agents. Now, let me tell about the disadvantages of immunotherapy. Now, one thing Dr. Rupesh had given a passing mention that, we need some special tests for doing immunotherapy, for making sure that the patient will benefit with immunotherapy. These tests can be a little expensive, and the immunotherapy drugs themselves can be expensive. So all patients may not be able to afford such immunotherapy agents. Now, the next thing is that immunotherapy agents take some time to act, whereas chemotherapy agents have a very short duration of action. So supposing a patient comes to us with a lot of disease throughout the body, it has spread to multiple bones and is very symptomatic because of that. So because our immunotherapy agents cannot have a rapid onset of action, in such patients, chemotherapy would be a preferable option compared to immunotherapy. Now, the next problem with immunotherapy is that as compared to the targeted agents described by Dr. Raji, immunotherapy agents are bigger in size. So they cannot penetrate into our brain parenchyma. That is the reason patients with brain mets who come to us with stage 4 disease having brain lesions as well, immunotherapy may not be very effective against them. Definitely, immunotherapy will have action on rest of the disease elsewhere outside the brain, but lesions that are within the brain may not be very amenable to treatment with immunotherapy. Now, the fourth most important problem with immunotherapy is that these have to be continued lifelong till the patient is responding to them or till the patient has some toxicity to immunotherapy. Whereas chemotherapy, we fix some certain number of cycles and then we can put them on maintenance. Immunotherapy have to be continued lifelong. So they obviously will have certain immune related adverse effects, IRAs, those are called, and usually they affect our endocrine system. So they can have thyroid dysfunction related to cortisol or ACTH and all those things, and immune mediated liver problem, immune mediated GI problems can have with long-term usage of immunotherapy. But however, they'll take certain time to act, about 3 or 4 months for these side effects to develop. Also, they can have effects on the lung tissue as well if they are chronically used. This is called as immune-related pneumonitis or interstitial pneumonitis. So these are the important side effects of immunotherapy agents that we commonly come across. Now, you may ask me that, patient has come to us with lung cancer. We did a biopsy. The biopsy report comes to us soon enough, but the molecular test analysis, that takes some time to arrive. It may take somewhere between 2 weeks or 3 weeks in some labs. So is it mandatory to wait for those tests to come, or can we directly start treatment? Because only if those targeted mutations are present in the body, in the tumor, or the test for immunotherapy comes positive, then only we can use such agents. So my answer is simple. If a patient is minimally symptomatic or not very symptomatic, the disease is not too much of an extent, it is better to wait for the molecular test and the test for immunotherapy to come rather than directly starting these patients on chemotherapy, because these patients definitely have much more benefit with targeted and immunotherapy as compared to chemotherapy agents if those mutation tests come positive. So supposing, as one scenario that I mentioned, where a patient comes to us with extensive disease, lot of cancer lesions throughout the body, in such patients, we can directly start with chemotherapy rather than waiting for our molecular test report, so that the patient's general condition improves with our chemotherapy, the disease comes in control to some extent. Later on, we can switch those patients to either of the targeted therapy or immunotherapy based on the molecular analysis test reports. So over to you, Dr. Rupesh, for this.
So, this was the discussion regarding advanced lung cancer. So here are some of the steps to protect ourselves from lung cancer. So if we know what are the symptoms, then we can go to the oncologist earlier. So the symptoms will be like cough, which is more than 3 weeks, which is not resolving for any medication, and unexplained weight loss within short span of time, and long-standing and low-grade fever, pain in the back, and headache. These are some of the common symptoms which will alarm the lung cancer. So better to consult a oncologist, better to have opinion.
Yeah.
We have onco cancer centers all over now in Hyderabad as well as Kolkata. So we are coming up all over India as well. So visit a onco cancer care center which is nearby as early as possible. So Dr. Rajiv.
One thing I would like to add is, like, we have the option of doing lung cancer screening. That is in very high risk individuals who have a history of 15 to 20 pack years of smoking, and those who are within like the age group of 50 to 80 years, they can be screened for lung cancer. So what is screening? Screening is like they don't have the symptoms, but we are trying to detect if they have a lung cancer. So we can like somewhat detect it in an earlier stage, and they can be given proper treatment. So nowadays we can do screening with low dose CT scan, which is nowadays available at all centers.
So we have a query from YouTube. So does smoking hookah 4 times a year cause lung cancer? If yes, then how many pack years? I think hookah we cannot define in pack years. So what is the content of hookah? Hookah, if they consume tobacco, then definitely they will have higher risk of developing cancers, lung cancer especially. And 4 times a year is not this thing, but significant risk factor for developing lung cancer 4 times a year. But definitely there is a risk.
Because this is somewhat cumulative, like it gets on accumulating over the years. Right. So
yes, cumulative risk is there for smoking hookah. Yes, if you are smoking tobacco in the hookah, and if it is not tobacco related product, some herbal, something like that, then I think there is no risk.
Right. So let me add some more on the preventive aspects of lung cancer. As Dr. Rajiv had mentioned, smoking tobacco is the most important risk factor. So quitting smoking cigarettes or any other tobacco products in any form has shown to reduce the risk of lung cancer substantially. Even other risk factors like environmental pollutants like asbestos, in mining industries or in construction industries, the workers are continuously exposed to environmental pollutants. So if we take any measures to reduce their exposure by using appropriate equipment, using mask or high filter mask or PPEs or something, we can reduce the risk of lung cancer substantially in these patients as well.
Okay. And one more question, Dr.
Yes.
which I get from my patients is like they have got lung cancers, and they ask, is it beneficial to now quit smoking, or it is a very question is they ask.
Right. So studies have shown that patients who stop smoking after they get diagnosed with lung cancer definitely tend to do better than patients who continue to smoke even after diagnosis of lung cancer. So patients who quit smoking, they have better responses to treatment, they have better survival, and they have better chances of disease, of lesser chances of disease progression compared to patients who continue to smoke even after their cancer has been diagnosed. So apart from quitting smoking, you need to have a healthy and balanced diet, consume fresh fruits and vegetables, have a healthy lifestyle, reduce obesity, keep your body weight in check, do regular physical exercises, and maintain a stress-free life. All these are preventive aspects of lung cancer and other cancers in general.
One more thing I would like to add, that if it has been shown that if they quit smoking, like there is gradual risk of decrease in the risk of getting lung cancer, and it almost gets normalizes within in 15 years. After 15 years, they are like normal individuals. So that is very important.
Yeah, definitely. The thing is, if we take a short-term follow-up, so patient who has quit smoking for within just 1 or 2 years, their risk is definitely higher compared to patients who have never smoked at all. People who have never smoked at all, their risk is definitely higher in patients who have quit smoking in the recent past. So quitting smoking for a longer period of time definitely has better advantage and reduced risk of lung cancer compared to this. So now that we have spoken about the preventive aspects and all, let me just add about the prognosis of advanced lung cancer as well.
Yeah.
So as we know, stage 4 lung cancer is an incurable disease. Whatever treatment that we are giving is only to control the disease and prevent it from further progression. Supposing patient refuses to take any form of treatment in a stage 4 lung cancer, so studies have shown that in such patients, the median survival time is somewhere between 10 to 12 months. And the probability that that patient would survive till 2 years is just about 7 to 10%. And if the patient comes to us directly with brain mets, so the cancer has spread to the brain, the prognosis is even worse. Their survival is just less than 6 to 7 months as compared to patients who do not have brain mets or the disease has spread anywhere else apart from the brain. So these are the important take-home points when it comes to preventive aspects of lung cancer, the prognosis and the treatment, the different modalities of treatment that we have summarized.
And following a healthy diet, balanced diet, like
Yes.
fruits and vegetables, encouraging more intake of leafy vegetables and
Yes.
healthy food habits is
Right.
shown decreased risk of lung cancer. And
Dr.
regularly
Rupesh
exercise.
right. And as Dr. Rupesh already mentioned, if there are any warning symptoms that may be suggestive of lung cancer, you can always consult an oncologist at a nearby onco cancer center, be it in Hyderabad or Kolkata or anywhere else, and then you can get treated and evaluated accordingly.
Yeah. Thank you, Dr. Rajiv and Dr. Subur, for a very informative session on advanced lung cancer. Thank you so much.
Thank you, Dr. Rupesh, and thanks everyone for listening.
Thank you.
Goodbye.